Morning. Please introduce yourself and tell us where you work.
My name is Laura Andrews. I am a PT. I work in acute care at UNC Medical Center. I've been a PT for about 5 years now. Worked for a bit in New York, and now I'm at UNC. And I primarily work on the cancer hospital with oncology patients.
Wonderful. Can you share with us what typical day looks like for staff members of your team?
In acute care, we really have no typical workday. Things are always changing with patients. I'll get a patient list for the morning, and it will completely change by the end of the day, based on patient priorities, if there's any discharge pending patients, if patients aren't appropriate for therapy. So my motto really in acute care is like, go with the flow. You just have to kind of be flexible with your day because it's very unpredictable.
I would imagine so. For all of your responsibilities in your job, both patient and non-patient related.
You're breaking up. Say that one more time.
What are your responsibilities in your job, patient and non-patient?
Patient is to try to see 6 to 8 patients a day, address any priority patients, patients that need notes from us to go to SNFs or to go to rehab. And then my non-patient duty is to triage the patient list. So coming in the morning and putting patients on people's lists and making sure that patients are seen in the day. I do a lot with wheelchair seating. So me and a few other people in the department are wheelchair experts. So any patient in the hospital that's going to potentially need a custom wheelchair to go home, we do that. So yeah.
Nice. You mentioned the average number of patients that you saw each day and a little bit about the pace of your service provision. Can you talk a little bit about what the structure of your day looks like from a timing standpoint?
Yeah. So I work an 8-hour day, so I try to see 6 to 8 patients a day. It's usually a combination of evaluations and treatments. For us, documentation for evaluations takes a really long time. Treatments, the documentation I can do in a few minutes. So sometimes my day in terms of patient care flows a little easier if I have a lot of treats, just in terms of documentation. I don't document in the room with patients because I want to give them my full attention. And they're sick people, they're complex. So you really need to be there with them and have your eyes on them. On oncology, where I work, we have a lot of frequent flyers and people that spend months there. So I'm lucky in that I get to know a lot of these patients because I've just seen them so often and establish a good rapport with them. So that kind of makes my day at least flow easier. The chart reviews are less, documentation is less. So not every unit in the hospital is that way, but I'm lucky on oncology that I often already know my patients.
And working in oncology, can you elaborate a little bit more on examples of specific diagnoses that you see and the types of complexities that you're evaluating and treating each day?
Yeah, so we see what you would call like liquid cancers. So on patients with AML, leukemia, lymphoma, multiple myeloma, and then we also see solid tumor patients, so breast cancer, GI cancers, pancreatic cancers, melanoma, or kind of prostate cancer, kind of our like really big ones. So we cover the floor that is kind of like the general like medical oncology. A lot of those patients are getting chemo, or they're there for neutropenic fever. And then we also cover the surgical oncology floor, which is those solid tumor patients. Also see a lot of patients that have head and neck cancer. And we also cover the patients that are getting stem cell transplants. So that's the bone marrow unit that we cover.
What skills are needed to be successful in your environment?
I think I already kind of alluded to it. Flexibility, like I said, your day is anything but predictable. Things are always changing. There's a lot of times we can't see patients because they're just not appropriate for therapy, because it seems like in the hospital, patients are getting more and more complex with their medical issues. A lot of times they're not stable enough to be seen by us. And sometimes, sometimes patients just don't want therapy. So it's kind of different than outpatient where the patient comes to you for therapy. In the hospital, you're coming to them for therapy. So there's, that can throw a little bit of a wrench in the day when you prepare to go see a patient and they don't want to spend time with you. But that's understandable. They're sick, they don't feel good. And then, we have a lot of patients that are off the floor for an important test or they're going for a procedure or to the OR. And you never know those things, from the get-go, from when you first get your list. It could be you walk into the patient's room and you figure out that you can't see them for whatever reason. And then I think in oncology, at least, you have to have a willingness to sit down and spend time with patients and listen to them. A lot of them know that they only have so long to live, so many months to live, if not weeks. So sometimes you have to be able to sit down and take that time. Sometimes it's not therapeutic, you're not doing PT, but to hold their hand while they cry. I've had lots of patients cry with me, or to, sit there and let them tell just stories about their life and laugh with them. So that's, I think a lot of people have a hard time sometimes with oncology about that like emotional component. But yeah, I mean, in general, our days are just very unpredictable. So you have to be comfortable with going with the flow and having your plan for the day just completely go out the window.
And can you speak a little bit about how you personally became comfortable with oncology and just speak a little bit to any type of self-care that you engage in to make sure that you can be strong for your patients and provide that support?
Yeah. I think in terms of self-care, I really enjoy my team that works on oncology. We have 3 PTs, me included, 2 OTs, and we have some rec therapists that work up there. And I think that we all lean on each other, and then if we need to go do something that releases tension, like even going down to Starbucks to get a coffee and just getting off the floor, or some kind of self-care things that do. And sometimes I take days off kind of randomly at the last minute because I need that break from. I mean, oftentimes working in oncology is very sad. You have patients that are dying and that do die and that you've spent a lot of time with. So sometimes you just kind of need that day off. And in terms of just getting into oncology and how I came to like it, this is the only place I've worked that really has like an actual cancer hospital. And I think in terms of PT and OT, it's an area that is kind of up and coming and hasn't had a lot of focus on it, and there's starting to be more research and more focus on it. So I kind of saw it as something that I could easily get into and hopefully make a difference in not only UNC and the cancer hospital, but just in helping to promote oncology, PT, and OT.
That's fantastic. Thank you so much for sharing those personal details and also just about how you ended up at UNC and became interested in oncology. You did speak about collaboration with OT and rec therapy. What other professionals do you work with on a regular basis?
Case management, or at least in the cancer hospital, we are literally like 10 feet from their office. So we're always popping in there to ask questions and to let them know our recommendations. They make sure that they keep us up to date as they can. And that's, when we're working together, it means that patients are hopefully getting out of the hospital quicker. Because a patient can't go to a SNF or to rehab without having PTOT, like updated notes. And case management needs to know what we're recommending so they can go ahead and start that process, which kind of starts from day one. We have residents that work on the floor. I really enjoy working with the NPs and the PAs that we have on our service. They stop by and spend that time to raise concerns about a patient, PT, OT related concerns. Just generally give us updates about what's going on with the patient. We're all the time getting requests from them to prioritize this patient, and this is why. It's nice to know where you need to put your focus sometimes, because we just, so many patients come through our service that sometimes you don't know what you need to focus on. And if they say that it's important to focus on this patient for whatever reason, then we do that.
What are some things that keep you motivated on your job?
Well, I like I spoke about earlier, oncology patients can often spend weeks, if not months, with us because of treatment. They often end up going to the ICU, which is, we don't cover the medical ICU. That's another team. And they often come back super deconditioned and not at all where they were prior to the ICU. And then on top of that, a lot of skilled nursing facilities don't want to accept oncology patients to get some rehab after the hospital stay because sometimes chemo is expensive, sometimes they don't like their poor prognosis, and sometimes they need to travel back to UNC for daily radiation. So these patients often just kind of end up getting rehab by us in acute care, which is kind of cool. Like, I work in acute care where, I may see a patient once and then they're gone, especially on other floors, like the service that I don't cover. But these patients I get to see like day after day, and be able to, get them from only being able to barely get to the edge of the bed to potentially walking in the hallway and then potentially going home. So it feels cool in acute care to be able to kind of do like a little like acute care rehab situation and get to spend that time with patients. So I think it's kind of the best of both worlds being on oncology. You get that kind of rehab component and you also have your acute care patients.
It does sound like a really good combination and an environment that definitely would, number one, keep you on your toes, but also every day sounds like it could be a different day and a new day, which would be good in that aspect. Just out of curiosity, when you take students, what are some skills that are particularly helpful for a student to have, and what would you like a student to know about coming into this particular setting?
Skills that they have. I always encourage students to, I give feedback, of course, but they need to be able to give themselves feedback and look at what happened during a patient encounter and give some good things and some bad things. So I think, that willingness to take ownership of how you did, whether it be really good or really bad, I think is important. We've talked about flexibility. I've had students that, they like order and they like a schedule, and they probably fit better in like outpatient PT. So that's really difficult for them. But if you're in this setting, you just kind of had to be able to tolerate that. The unpredictability about it, I think is one of the hardest things about being a student in acute care. So yeah, you asked one more question, but I don't remember.
Any particular challenges that students have faced in the past coming into the environment?
Um, you know, I've kind of spoken about empathy, and I think that oncology specifically, it's hard for them to. I've noticed it's hard for them to want to go in and spend time with patients that have a horrible prognosis, that cry and get upset with them. Because until I worked in oncology, I had never had a patient cry to me about I'm going to die in a month. So it's hard to know what to say in that situation, and unless you've experienced it a few times, it kind of catches you off guard sometimes. And I think with students, it's definitely really, really caught them off guard, and it's kind of like deer in headlights. But just really kind of working on that empathy for these patients, and knowing that you don't even have to say anything necessarily, but being able to sit with them and take that time is important. And I think that's very unique to the oncology population for sure, because there's a point where their physicians tell them you have this much time left, so it's very well known when their time is up, and that all the fears and the worries tend to come out, especially because as PTs we maybe nursing, but we do spend a significant amount of time with them, like chunks of time, compared to the doctors that kind of sweep in and sweep out. So we tend to be the ones that kind of get all that fear, and need are the ones that need to sit with them. And I don't think a lot of people have experienced that. So I think that's a really big challenge for students in terms of at least the oncology service. And like I said, the flexibility can be hard too. But that's why a lot of us work in acute care, because we like the unknown and the unpredictability. It makes things interesting.
Absolutely. I always enjoyed that aspect when I was in acute care. Any memorable patient story that you'd like to share?
Um, I can't think of anything particular, but I think, like I've kind of spoken about, the ones that always stick out to me are those ones that are kind of stuck with us in acute care because they can't go home and they can't go to a SNF and they can't go to our rehab. So those patients that we spend that amount of time with, and especially the ones that we've been successful in getting them home. That means so much to the patient, especially if they've already spent a ton of time in the hospital. So there's no one in particular, but those cases are always wonderful and keep me motivated to stick with the oncology population.
Laura, thank you so much for sharing your time and your personal expertise experiences with us. And again, we just really appreciate this. Thank you.
Yeah, thanks. Have a good one.